Welcome to our latest episode of the Lebanese Physicians Podcast. And this is episode 97. We're getting close to 100 episodes at this point. And it's co-hosted by MohammadAli Jardaly. We will be discussing today sports medicine and its evolution in the Middle East and North Africa region. And our guest today is Dr. Tarek Gerbal, who is actually a doctor of physical therapy who graduated from the Université Saint-Joseph in Beirut, and currently is working at Amman Hospital, which is a new community hospital that was established in Doha, Qatar, and started 3 years ago. Welcome, Tarek, to the podcast.
Thank you, Khalil. Thank you for having me. Thank you, Muhammad Ali.
So Tarek, I was gonna ask you, I think before we get into sports medicine and everything, I think what made us reach out to you and connect with you is your recent presentation at the ACSM, or the American College of Sports Medicine annual meeting, which was titled Post-Surgical Rehabilitation of the Shoulder Triple Tendon Transfer in a Fitness Athlete. Could you discuss your thoughts on the significance of Lebanese representation in global medical conferences and how this can inspire future generations?
It's a great conversation starter. So the idea started 3 years ago when we had a very unique case diagnosed with a trapezius paralysis. And usually these cases are left to deal with disability for the rest of their lives. It affects their shoulder and their neck, and they lose ability to raise their arm above their head, and the arm remains up towards a ear level. Together with the progression of the disease, the scapula impinges the shoulder girdle, and it eventually starts to gradually degenerate the rotator cuff, which adds to the disability and pain of the patient. Now, among the possibilities of treatment, it goes through a time frame. So the first year, this paralysis, because it's traumatic, it affects the spinal accessory nerve, and neurosurgeons will try to reconstruct the or repair or graft in the first year the spinal accessory nerve. But it is usually a misdiagnosed case, and it goes through the first 1 or 2 years with a couple of misdiagnoses. Typically, physicians will diagnose the case by being a muscle spasm or a typical cervical neck or shoulder pain, upper trapezius type of pain. It will not come to the first time, or your initial thought when facing this patient will not be a paralyzed trapezius. So eventually, when the time comes to diagnose it with an EMG and to confirm a spinal accessory nerve injury and a loss of function of the trapezius muscle, at the time would be too late to reconstruct the nerve. And the last resort will be a tendon transfer. Muscle tendon transfer in orthopedics is a very specific area of specialty in orthopedics. Not all surgeons will adventure in the world of transferring tendons, because you are changing the anatomy, mechanic, and function of a joint. So you are changing positioning, and this is based on a lot of biomechanical studies trying to make sense of what works best in terms of which tendon to transfer where. Now, the case that we took is called shoulder triple tendon transfer. It was a piloted case by Dr. Bassem Al-Hassan, who's currently an instructor at Harvard, and he's chief shoulder surgeon at Mass General in Boston. But at the time when he did the surgery, he was still at Mayo Clinic. And the case was done in Beirut, and he traveled from Mayo Clinic to Beirut to operate on this lady who used to be a patient of ours. Eventually, because it's a very novel technique that Dr. Bassem Al-Hassan has it's named after him, actually. He developed the technique, and he developed how the new tendons are going to be transferred, and it's named after him. It's called the Al-Hassan variant now, because so many cases around the world are being done following this technique. Before he developed this one, there was something called the Eden-Lang variant. So he modified it to make it a little bit more mechanically appropriate. Now, what is interesting and what is novel about the case is that the rehab protocol do not exist for these cases. They do not exist anywhere in the literature. We know nothing about them, and we had to come up with everything from scratch to make sure that this lady goes back not only to function meaning she can raise her arm above her head, but also to go back to her fitness programs and weightlifting and overloading on the shoulder joint in all degrees of function. So the ACS, we submitted the case. I wrote it with a co-author, a friend of mine who helped with the case. And we submitted it to the ACSM, the American College of Sports Medicine, who was very interested on how things were put together and developed and the outcome that we gave to this patient. And I ended up presenting the case at their annual meeting last May in Boston. And the feedback was excellent. Now we are getting the momentum after this presentation is picking up. A lot of people are learning about this, and they are interested in learning the details of how this process got developed. So yeah, this is it. I hope it was comprehensive. Uh, what do you think? Does this sound like a good plan?
Yeah. Congratulations, first of all, on
Thank you.
developing this protocol. It's a pretty intense protocol, right? I think it was like a 16-week protocol.
It is a 6 months rehab followed by a 6 months training. So it's a 1 year protocol, and because the healing continues to happen on a soft tissue level up to 3 years following the surgery. And this is based on the instructions of Dr. Hassan, who was very supportive and he was guiding the way throughout the whole thing, because he also needs this type of complementary work to help his patients around the world who seek his expertise and his technique. Yeah. So developing this protocol is supporting all the patients that are following this treatment protocol or option, because it is a novelty and it is new in the sense that it enables the patient to go a little bit beyond what we previously thought was the limit. Yeah. So previously we would want the patient to be able to pick something off a shelf that is slightly high up, put on a shirt or a jacket, and that's it, and just carry basic stuff like groceries or whatever. This lady, if you see the videos, she was back to lifting heavy weights and above her head, pressing weights and deadlifting her own body weight. And so, yeah, so we were able to push the limit of not only the surgical technique, but also the surgical material, the sutures, the wires. So all of the surgical instrument company who developed the technique as well with Dr. Bassam Hassan was very interesting to seeing this in situ, if you want, in a live patient who managed to continue developing throughout the year of treatment.
How is the patient doing now?
She is doing wonderful. So now she is 3 years after surgery. She relocated. She was based in Beirut. Now she moved to Dubai. She's happily married. She reached out a couple of days ago because also Lebanese media got interested in the case. So we had to film an episode for MTV regarding her and regarding a new case who is currently in Beirut, who is seeking the same treatment, who has the interesting also that she shares the same name as the previous patient as well. So it is an interesting aligning of the stars, if you might say. Now we're trying to help this patient in Beirut, but it makes things a bit more complicated because everyone is in a different part of the world. So we're trying to help this young lady who has the similar condition now by having her go through the same thing again.
I mean, this is pretty significant, this like transfer of knowledge and this multidisciplinary collaboration, but also across like different continents, right? So,
correct. So this is also what was interesting for the ACSM, because it highlights the importance of multidisciplinary collaboration. So initially, the professional who triggered the process for this first patient was her fitness trainer. Yeah. So he saw something that was very odd with the shoulder movement, and it did not make sense to him. How is this function not happening properly? So he reached out to me, and one thing led to another, and we reached Dr. Bassam Hassan, who eventually proposed that this is the treatment that we need to follow, and now lives have changed So the interdisciplinary collaboration between, if this is going to lead to our discussion on sports medicine, so the surgeon, the physiotherapist, the trainer, the continuum of care, if you want, that ended up putting the puzzle together for this patient who got back to her active lifestyle and pushing the limits of her fitness journey after a very, very significant injury who was disabling at one point.
Right. And it seems to me like this is a good segue to get into, for the listeners, to get into what sports medicine is and what it involves, because some people might not know the extent of what sports medicine covers and how important it is. So can you just briefly tell us about the sports medicine and what it involves?
Great. So I got into sports medicine out of curiosity and interest and passion initially back in 2007, 2008 in Beirut. I worked at AUB. I was medically in charge of the Charles Foster Student Center. Now, if we have AUB students listening to us, I was medically in charge of the sports facility of the American University of Beirut from 2008 to 2021. Yeah, for 13 years. I assisted in management, and I had developed their quote unquote medical programs. Yeah, we were offering on-site interventions and treatments for UB athletes, and we had an extended arm towards academics through the Faculty of Health Sciences, the Faculty of Agriculture and Food Sciences, especially the Nutrition Sciences program, and through the family medicine because of primary care and because of pre-participation screening for our athletes because they needed to go for a checkup. And this is a program that we also developed with the family medicine department at UBMC. Now, throughout this journey of 13 years, things grew, obviously, and the interest in sports medicine grew. And we had a lot of medical professionals who were coming back from the States with fresh training in sports medicine. We were taught by them, we were mentored by them, and they were helping us develop our practice in sports medicine exponentially faster compared to when you do not have a mentorship. Yeah. So among, I'm not sure if I'm allowed to mention some names. Can I mention some names?
Hassan Baidoun.
Yes. Hassan Baidoun comes first, and يعني ما في كلمة بالإنجليش. So شهادتي مجروحة. Yeah. He's among the people who piloted my personal experience in sports medicine. I also have to give credit to Dr. Afif Mufarrij as well, who's still at the ER at UBMC, because Dr. Afif Mufarrij did the primary care sports medicine fellowship at Henry Ford, and Dr. Hassan Baidoun was surgical sports medicine. So here I would like to make the distinction between the two. So a sports medicine trained doctor can be a surgeon, but they also can be a non-surgeon. They can be in primary care. And together with Dr. Baidoun and Dr. Farij and myself, we did put together the primary care sports medicine fellowship program at the UBNC, that is still running until today. And whoever is graduating from primary care, they could be trained in pediatrics, in family medicine, or in emergency medicine. They can get trained in primary care sports medicine as a fellow at AUBMC and AUB after this program. Now, as a practice, it is still in some parts of the MENA region. So if I'm allowed to elaborate a little bit on that, in some countries, the practice of sports medicine is a lot more developed compared to other countries. Now, this is based on how much exposure to sports you have in that country. Yeah, so it is reflective of the sports state. So if you do not have professional sports at a high level in your country, chances are your sports medicine practice is not going to be up to an international level. You might run a busy clinic, but you are not into the professional aspect of handling a professional athlete. Yeah. So sports medicine deals with everything that helps the athlete stay in the game. And if you go in depth of what sports medicine is, it is all disciplines that you take in medicine, but they are adapted to the athletic demands of the athlete. Yeah, it could be cardiology, so you have sports cardiology. It could be orthopedics, obviously, because 90% of the complaints you see in a sports medicine clinic are MSK. And orthopedics play a big part. Now, in a busy orthopedic practice, 90% of the cases are non-surgical. So if you follow proper indications of diagnosis and treatment and referral to surgeries, you will see that your 90% of your cases will require conservative treatment. And these cases can be handled by a primary care sports medicine trained doctor. Yeah. So interestingly, you have a lot more disciplines that can be adapted to the athlete. Dentistry is one of them, rheumatology, obviously. I mentioned cardiology previously. And there are sub-disciplines that work in sports medicine that are not very available in the MENA region, but they exist out in other countries in the world. I would like to mention clinical exercise physiologists, for instance. You will see many of them in Australia and the States and in some parts of Europe. CEPs, clinical exercise physiologists. These are people who test your physical abilities in different scenarios. Yeah. So they test your cardiorespiratory system, your VO2 max, your cardiac abilities, your strength, your flexibility. These are not physiotherapists because physiotherapists who also have a wider scope of practice. They do not only deal with athletes. As a physiotherapist, you get to see a wider population. You get to specialize in pediatrics, in neurology, in orthopedics. And so different professionals can work under the umbrella of sports medicine. You could be an orthopedic surgeon. You could be a primary care physician. You could be a physiotherapist, a clinical exercise physiologist, a nutritionist, a psychologist. All these can work under the umbrella of a sports medicine team.
A very, very fascinating overview. And it's good to like distinguish between the different players. I wanted to ask you about like kinesiology. I know it's like big in the US and Europe, but we don't hear much about it here in the Middle East and the GCC. Can you comment a little bit about that?
Yeah, so you will see kinesiologists in the States, in Australia, and in some parts of South Africa, if I'm not mistaken. They have very interesting schools in South Africa, and in some parts of Europe as well. Kinesiology is the study of human movement, is the study of biomechanics. Yeah, so it's the study of biomechanics, it's the study of human movement. Now, it doesn't necessarily reflect towards clinical practice. Now, to have a clinical practice, you need to understand pathology, disease that affect the mechanics of the human body. And kinesiologists study the human movement in a healthy state. Yeah, in a healthy state, meaning that they are more related to sports science than they are related towards the injury and disease part. Yeah, so it is a very interesting area of study. However, it has a limitation because they end up working as instructors at universities that are very theoretical, and they find it difficult to apply their knowledge to practice.
Yeah, so go ahead, MohammadAli.
Yeah, I just wanted to go back to the point you were raising before about how sports medicine really depends on the state of sports in the country you live in. So right now in the Gulf, especially in Qatar with FIFA a couple of years ago, Saudi also have the bid for FIFA. Do you see like the scene changing?
Totally. Also, listen, the Emirates is also putting up a big scene in sports medicine. Emirates, between Dubai and Abu Dhabi, they have great facilities. They're attracting great doctors. They are hosting the FIMS conference in October. So, donc the Fédération Internationale de Médecine du Sport, FIMS, is the International Federation of Sports Medicine. Every 2 years, they have their annual conference that happens some part of the world. It is hosted in Dubai next year. Not next year, next month, I mean, in October. So obviously Qatar as well. Qatar with they're spearheading the sports medicine scene in the MENA regions through Aspitar, and they are doing high quality research, and they have a sports medicine hospital that is really world class. It's attracting international talent for practice in terms of surgeons and non-surgeons, all the way from the spectrum of rehab towards clinical sports medicine, cardiology, dentistry, and orthopedics. Yeah. Saudi as well is trying to put together a very strong scene in terms of sports medicine. because they are bidding. I believe they're also bidding for the Olympics soon, to host the Olympics, if I'm not mistaken. But they also bidding to host the World Cup at one point. So the sports scene in Saudi Arabia is on the rise to become a boom very soon. They're trying to put together an Olympic an Olympic committee that handles the health and sports, the health of their athlete on a very high level. And I think we're going to hear more and more of them in the very near future. So I think between the Emirates, UAE, and Qatar and Saudi in the near future, the landscape of sports medicine will very gradually change towards becoming more world class, as the world is continuously being interested in this part of the world for investment and growth. And sports is only another part of that. I also believe that specifically in regards to football in Saudi Arabia, since they're managing to attract a lot of football stars, you need to bring the stars in, you need to offer support services. Support services not only as sports facilities, fans, and media and everything, but also in terms of the level of the medical services you offer. Now, the more people are going to watch your game, as you attract Cristiano, Neymar, Benzema, and everyone, the more people are going to play the game, the more you're gonna need more clinics and more specialists that are going to understand football and offer more football-related services. It is definitely on the rise. It's a growing area. It's going to boom very soon in Saudi Arabia. And they are benefiting a lot from the experience of Qatar in hosting the World Cup. So we see a lot of people leaving from Qatar to Saudi Arabia because of this experience they gained by hosting the World Cup.
And I definitely see it like trickling down to the general population, right? When you have all those big teams, you want to feed them with local talent. So a lot of the patients I see are involved with like the local clubs in Saudi. And I think there's a definitely trend to oppose the obesity epidemic that this region has been notoriously struggling with. Like there is a rise for like fitness and health consciousness, especially in the younger generation. Like you see a divide, like people who are like very fit, very athletic, and then the people who are obese. So it's interesting to see this trend and this transformation.
Totally. We're not big fans of trends, but this is a trend that we like to see continue to become a norm. Yeah. So we would want people to become continuously more physically active in an effort to continue the fight against obesity, obviously. More and more evidence is supporting physical activity as being an intervention in that. You also need some work to be done regarding the nutritional habits. But I mean, it is a chain. It's definitely trickling down. It is because I've been living in Qatar for the past 3 years. I see Qatar as a great example. You have communities that are active, communities by themselves that are active across age groups, not necessarily the youngsters. Yeah. So you see older athletes in Qatar, which is very interesting. They're equipped. They have their Olympic cycling track. They have their walking parks. They have their gyms extensively. But Qatar has been on the rise to host the World Cup since 2008. So from 2008 to 2022, these are 14 years of setting up to the event. And this is something that also is reflected on the infrastructure, on the programs that they have, on the schools, universities, and everything. Everyone is involved somewhat in a sports scene. Qatar has their own sports national day, which is a public holiday for everyone. You see the whole country on the street doing some sort of sport. Yeah. So this needs to be a governmental decision. Yeah, it needs to be a governmental decision. I remember attending few meetings that were leading to the World Cup because we were part of the medical team that was, if you want, like moved around by the Ministry of Public Health, that you wanted all your medical sector to be very ready because you have like hundred thousands of people that are moving from one area to another. You need to be ready. You need to have your emergency plan and everything. So among the meetings that I attended, There have been studies that are done in Qatar regarding the role of football in the combat of chronic disease such as diabetes, hypertension, not only obesity, you know, the spectrum of obesity and metabolic syndrome and everything is huge. So having different age groups engage in football specifically, because the whole focus was on football, helped reduce their biomarkers that are affecting their chronic diseases. So these meetings were very interesting for me because it's not only about the fans and the media anymore. It is changing the health of the people in a very practical and fun way. So yeah, so you need a governmental decision, definitely. It is the state, it's not the sport. The sport is a tool, but the state needs to channel it, yeah.
Right. I think just to basically, it's sports medicine becoming an important field because more and more states are now noticing the importance of movement and sports and improving health of their people, which actually improves the health of the country as a whole. And I think you have summarized to us. I mean, I've learned a lot from you today about like the surgical part of sports medicine versus the primary care part of sports medicine versus the physiology part of the
Yes.
field. And I think the primary what we're going to focus on for you is the primary care part and actually the post-surgical part, because physical therapists I think play an important role in both preventing surgery or treating patients before they get the surgery and treating patients post-surgically.
Yes. So we sit on the intersection, yeah. We sit on the intersection. So we need to be familiar with what is done in surgery. We need to do our best to prevent it if possible. And we need to be ready that if a surgical decision was made and the patient is buying into that treatment because they cannot handle their current state, we need to be ready to get them back to function as soon as possible. Now, sports medicine and physiotherapy overlap in the part that is what we call sports physiotherapy. Yeah. So not all physiotherapy is sports physiotherapy. I come to this point in my career because I had a passion for it and I worked towards developing it more and more. And I think I will continue doing that for the coming few years that are coming. I will follow a little bit more the activity of the ACSM in an effort to become a fellow of theirs in the near future, which I believe also as a physiotherapist is going to add a lot to my growth as a career growth, if you might say. But in terms of a profession, physiotherapists also do not necessarily wait for a surgical decision to happen. They can fully on treat a case that is deemed non-surgical and landed towards a healing state. And this is what we do daily in our practice. We work very closely with surgeons because we need their input, obviously, and we need their opinions about cases that sit on the fence, whether this is surgical or not. Sometimes you need the opinion of a surgeon to help you make that proper call regarding this patient. And we do our best to help our patients remain active and stay active. Now, the profession of physiotherapy is changing, or has changed tremendously in the past 10 years. It is moving towards becoming a lot more active in terms of an approach. Passive modalities or a passive approach to treatment is dying out gradually in terms of evidence. There's not enough evidence supporting us laying people on beds and doing things on them. There's a lot more evidence supporting us helping the patient, and we do things with them. Yeah. So exercising and staying active and making sure that the patient learns along the process is the way to go. It is the future of physiotherapy. It is becoming more and more educational. So I find myself spending an hour teaching things to a patient. Yeah. So the role of passive treatments is dying out. The profession is changing very fast as more and more evidence is becoming more available to us as professionals.
I also see that in my practice, like the role of coaching and walking the patients through what they need to do. Like if I'm going to send a patient for 6 sessions of physiotherapy, the work is not done. The patient needs to go home and do the homework and learn how to do the steps at home. Just 6 sessions with the physiotherapist will not get the job done.
Totally. And I always tell this to my colleagues when a patient comes to you and tell them, listen, I did 10 sessions of physiotherapy and did not improve, ask them what they did in physiotherapy. Yeah, so sending a patient to physiotherapy is like sending a patient to medicine. Yeah, so it's a rabbit hole. So they can do things that are not totally not related to the case that they have, especially in insurance-based practices. Yeah, so you need get a little bit more detail about what they did in terms of a treatment. Is it more active or more passive? If they tell you that they sat me down on the bed and they used this machine and they gave me a little bit of hot packs or cold packs or whatever, and yeah, chances are this is not going to work, and they're going to do like 10, possibly 50 sessions. I don't care the number, what the number is, and they're not going to improve. If they did not give them an exercise that is hard and that is painful sometimes, nothing is going to change.
Yeah,
definitely. And I think it's very important that we have people working in this region, because we cannot just import all the protocols from North America and Western Europe. For example, a lot of the patients I see do like total knee replacement. And even when we talk about like patient-related outcomes, PROMs, like one of the questions and one of the forms was like, did the surgery help you get back to your dance routine? And it's completely like not relevant to the patients we see. The patients, when they do the total knee replacement here, they want to be able to perform salah, right? They want to do sujood and ruku'. So this is when you work with a physical therapist, they need to do a protocol to help them get back to be able to pray, right?
Interestingly, I had this. I did not consider this before moving to Qatar. Yeah, so when I moved to Qatar, and it was a main ask from the patient that if I do the surgery, will I be able to play on the floor again? And I had the discussion with many people, yeah, with surgeons, with medical supplies company and medical instruments and the biomedical engineers. Many of these implants do not even allow you to go to that range. So it's not the problem of the surgeon or the technique or the physiotherapists, but many of the implants that are used in many parts of the world will allow you to go to like 120, 130 degree of flexion at the max. But to be able to play on the floor, not only will you need to go, it depends on the morphology of the patient, but no, you need to go slightly beyond that and bear weight as well. So not only consuming the range, but also your weight needs to be on top of it. And many of these implants do not allow you to do that. And so this is a discussion that the surgeon needs to have with the patient ahead of surgery, and to decide on the type of implant you need to have before you go into surgery, because it is devastating for them to go through the whole process and not reach their goal, and they will start blaming it on the surgeon and on the physiotherapist and whatever, but it's really the type of implant they used.
This is what I tell them. If it works in the US, it doesn't mean it's going to work here. So we need to like customize everything, the entire treatment protocol. So whenever I like refer a patient, like I make sure to them, they know why they're getting the surgery and what the outcomes are. And the work isn't done with just the surgery, right? You need to be involved in the physiotherapy. If you don't do your part with the physiotherapy, don't even bother with the surgery.
I'll give you another example about what works elsewhere and doesn't work over here. So in this part of the world, specifically, and this is sports medicine related, yeah, not physiotherapy related. So in sports medicine, the programs in the States, most probably they are all like, if you look at the content of the sports medicine programs that are being taught for doctors in the States, it is reflective of the popular sports. Yeah, it is reflective of what you are going to see in the population. So you see a lot of shoulder injuries and a lot of elbow injuries, yeah, because of the popularity of throwing sports. In this part of the world, you do not see as much shoulders and elbows as much as you see in the States. You see a lot more ankles and knees in the sports medicine clinic, because here you have a lot more sports that require a lot more cutting and jumping, cutting in terms of changing direction. Then, so you see a lot more of football players, basketball players, volleyball a little bit, yeah, but we do not have throwing sports. So there are one type of surgery that is very popular in the States, which is a Tommy John surgery of the elbow, which is the ulnar collateral ligament. It is a rupture and a repair of a ligament. We see zero in this part of the world. So an American trained sports medicine doctor who is a very tough Tommy John type of doctor will find it very difficult to practice in this part of the world. This is why Europeans excel over here, because they know football very well. So you see a lot more European practitioners working in sports medicine in the Gulf, because the sport that is popular there is popular here. So yeah, academic programs are developed based on the population that you see. And this is exactly what sports is. Sports is reflective of the population.
Yeah, Tarek, this was a great episode. I think we learned a lot from you about sports medicine, what it involves, and actually we learned a lot about the cultural differences. Like we just talked now
Yeah.
about sports medicine between North America, let's say, and the Middle East, and the importance of adapting your practice to these cultural differences. We also learned about the importance of physical therapy as a big part of pre-surgical and post-surgical rehabilitation in sports medicine. And hopefully we'll be hearing more about you and more about your presentations in the future. Thank you for being on this episode.
Thank you, Khalil. Thank you for having me. Thank you, Muhammad Ali.
Yalla, next time we're gonna have you, you're gonna be a fellow, inshallah, American.
Fingers crossed. Fingers crossed. Aiming for 2 more years, inshallah. We'll see how it goes.
Inshallah, inshallah.
All right.
Thank you, guys. Thank you.
Thanks.
Thank you for having me. Thanks a lot.